Hey, ¿qué pasa, Calexico? Welcome back to the podcast. Like always, before we begin, I want to thank my sponsors. I want to thank Camilo, Sergio, and Jake. Thank you guys for sponsoring the podcast. I also want to thank Dylan Castillo from Castillo Bookkeeping. If you're in need of bookkeeping services, make sure you contact Camilo Castillo Bookkeeping at 760-960-7601 or via email at acas1025@yahoo.com. Finally, I want to thank David Gastelum. If you're thinking of buying or selling a home in the Imperial or San Diego counties, make sure you contact David at 760-235-9576. He's not only a realtor, but an investor with over 20 years of experience, and he'll teach you along the way in one of the most important investments of your life. Also, I want to thank all the essential workers, nurses, doctors, everybody out there that's, trying to keep us safe and healthy, and people that are working our, supermarkets, pharmacies, everybody that's, trying to keep life as normal as possible in these, trying times. Also want to wish all the teachers, administrators, parents, students, good luck with this new coming school year. We're just starting with school next couple. I know a lot of schools already started, but Calexico starting on Monday. So yeah, I want to just remind everybody that, we're all going through this for the first time. This is new to everybody. So, be a little bit compassionate with the teachers as well, teachers with their parents, because this is new for everybody. So yeah, just let's have patience, and, we'll get through this as smooth as possible. Today I have two guests. One of them is a returning guest. She was, a guest a while back. But she's now helping one of the medical centers in Calexico in the Valley that is, helping our community, also through these hard times. My first guest is Marta Singh. Thank you for being here.
Thank you. Thank you so much for having me. I appreciate this opportunity to share with you the great things that are happening in our community. Sometimes we get bogged down with the stressors that we're living, but I want to take this opportunity to talk about hope and inspiration and the wonderful things that are happening here at Vo Medical Center. So I'll go ahead and wait until you introduce our rock star in our community, and we're very proud of all the work that they're doing from their office. So I'll go ahead and hand it over back to you.
And my second guest is Venus Vo. She is a nurse at Vo Medical. Am I correct?
I am a family nurse practitioner.
Okay. And can you tell us a little bit about, Vo Medical, how you guys got here? Because I know you're not from the Valley, right?
No, I'm not from the Valley, but we've been here for over 10 years.
Oh, wow.
I started out working in the hospital at El Centro Regional. Back then I was a nurse on the floor, and Dr. Vo was working as internal medicine doctor for the hospital. And in 2006, we met Dr. Strong, and with a lot of blessings, Dr. Strong gave his practice to us, and we carried on his private practice until now.
Okay.
And we talked about the center.
Okay. Yeah, because I know it was a big thing when you guys opened here in Calexico, because where you guys are at was like the hometown buffet, so everybody was like sad when the hometown buffet went out of business, and then you guys opened there. So like everybody's like, oh, what's opening in the old hometown buffet? So it was like Vo Medical. Like you said, you've been here for 10 years now, but have you ever, or did you ever imagine going through something that like what we're going through right now?
No, this is epic. No one could foresee or forecast that we would be having a pandemic. So this is something that took us all by surprise, took the world by surprise, not just, here in the Valley or here in the United States, but it took the world by surprise. Yes.
Yeah. And early on, you guys were, one of the first medical centers or places where people could, get tested. What made you decide to, start testing people so early?
We were very lucky. We're very blessed to have a center here where we have an in-house laboratory. So our laboratories, we acquired two machines. It's called Cepheid, that we acquired early last year, around September, October of last year. And we were utilizing the machines. It's a molecular PCR machines to run influenza at the time. So we were utilizing that. And when COVID hit, the machine was approved by the FDA to run the COVID test. So we were very fortunate and in a way very lucky that we had the machines, and we had the cartridges, and we had the test kit, and that was how it was started, by us having the machines in house and us having the test kit in house. So we were able to provide the testing very early on, even when the neighbor counties like the Yuma County or San Bernardino County or Orange County, they didn't have the test kit. So at the first 2 weeks when we started testing, we saw a lot of our neighbors that came. So people from Yuma, people from Orange County, people from LA, people from San Diego came down to get tested because they could not get tested in the areas that they live in.
What were some of the, besides having people from, out of the county come in, what were some of the experiences you guys were having in terms of, people, being scared, or, what was some of the stories that people were sharing with you, early on?
During the early days of COVID, back in March, it was so new to us, and there wasn't enough data coming out from the CDC about the transmissions, how the disease is being transmitted. There was a lot of questions whether this disease was transmitted airborne or whether it was droplet. So we took a lot of precautions. Everybody did. The whole medical community did. We were all geared up, and we were very new, and we took all precautions. I mean, we took it really serious, and everybody was on edge because we didn't know how to treat the infections, right? And we didn't know how it's going to run its course because it was so new. There was no data. There was no track record. There was nothing to go off of, but the information that was given to us by China. So at the beginning it was chaotic and people were afraid. So a lot travel again from everywhere, and we were overwhelmed. The first 2 weeks that we tested, we were overwhelmed with the number of patients that came. So we had to put out a notice out there that we could only serve the Imperial County, that we don't have enough test kit to serve all the other counties. So that we asked if they could politely ask the patients to seek help in the county, seek help, with their county department, the health departments, because we could only service the Imperial County residents here. Mm-hmm.
And Venus, something I saw right away from Bo Medical is I saw that you guys began to really provide services countywide. So I saw that it started in Calexico, and then I saw that there was a branching out of testing and services to the community. Could you share a little bit about that?
Yes, so it started in Calexico because we have the in-house lab in Calexico, and we have a big parking lot, and there was a huge need here in Calexico. There was no testing site in Calexico at the time. So we decided to start off in Calexico, and we, a week or two later, we stopped testing in El Centro because those are the two locations that we have business license. We had 2 offices, and we saw the need. We got phone calls from patients who were in Hopeville or who were in Brawley that are needing the service, but they couldn't commute to sites that we at. So we decided to apply for a business license so that we could go to other cities and provide what's called mobile testing. So literally, we jump on our to our.
Oops, you froze.
I think.
Yes.
Can you repeat that? Because
community center in the parking lot, and we test there, and then we went to Hopeville and test in Hopeville at the church. So we had a mobile clinic where we we go and we bring the tests to the patients. And at the time, the county didn't have the testing site up yet. We were the only one that did the test.
Oh, okay.
Yeah.
Go ahead, Martha.
And I think that just shows how responsive Vo Medical was. And, you know, it was scary and no one had instructions or a roadmap. But I'll tell you, I have seen that mobile lab and the staff piles in there and they go out and they provide that services. And I think when you were giving that shout out and thanking all the essential workers, I have to tell you that the staff at Vo Medical, they're out there, they're gearing up, and they were out there since day one, right, Venus?
Yeah.
And being able to provide those services, truly putting their lives on the line, and in the aspect of, not having all the information. Obviously, they were all in protective gear and so forth, but I'm talking about the serving heart to truly provide a service in the community.
Yeah, it was true bravery, because we were hearing all the stories about how physicians and nurses got sick treating COVID patients. So the staff were nervous. We were nervous. Providers were nervous going in, doing the testing and doing the treatment. And we were so close to the patients. And patient was literally, within a feet of us, with the testing and with the treatment. When patients are sick and they're needing help, you have to go in and you have to assess. And so we were very in close proximity with the patients, and not just us, the providers, but also medical assistants that are right next to us, side by side, helping treat patients, putting on oxygen, applying oxygen to the patients that are needing supplemental oxygens, needing treatment, needing IVs, needing injections. We would go out and we would do it out in the parking lot. So yeah, so I wanted to take this opportunity to thank my staff. Couldn't do it without them, and they are, in my eyes, they're heroes.
Yeah. Because it's something that, even for me, like going out, like I was telling Marta earlier that I started working last week, and I had been at home like all this time because I was like super careful about not going out, and just being out with people like was like nerve-wracking. So like I can imagine like having to be in an office or treating people that are, have COVID. It's I bet it's nerve-wracking. Moving on, you guys, have been helping out, a lot of our community, especially those that, are COVID positive and that can't really go out or don't have anybody to help them out with, food or groceries. You guys have been, helping those people with, food. Why is it important for you guys to, do this, go the extra mile for these people?
Because we encounter these patients every day. I'm on the phone every day with patients with COVID. At the beginning of the pandemic, there was just an overwhelmed number of phone calls calling in, asking for assistance, asking for help, asking for testing. And patients didn't know what to do, what directions to take. So we were on the phone up until, I would say, lately, every day it's been after we close the office, which is about 7:00, we don't stop the work there. We take a little break, and then we would be back on the phone again, calling patients, calling for test results, making sure that we do a follow-up checkup on the patients, all the positive cases, making sure that patients are doing well. And then for those that are having severe symptoms, send oxygen out or send them to the hospital. So it was continuous work, and easily every day we would be here until 10:00, sometime 11:00. And at times when we call late, we told ourselves, okay, we need to stop at 10:00 because nobody's picking up the phone. Patients are going to bed now, so we need to go home. But again, work doesn't stop there. So if we're not on the phone, we would be, sitting at the computers, checking labs, checking notes, addressing telephone encounters that we didn't get to during the day. So it was tough times. And now it's dying down. So the past 3 weeks, we've seen that the number of positivity or positive rates had gone down significantly. We see that reflected in our own data. And that's something that we are so happy and so proud to say that the community came together and did it. We have it under control now. So that's something that, that we should take pride in, and hopefully we keep this number where they are and continue the downtrend, not up.
Yeah. Are you worried about, spring and the change in weather, with the cases going up?
Going into the fall, we're going to probably be hit with another wave. So we have COVID on top of the yearly influenza. And the influenza and the COVID symptoms are very similar. So it's going to be hard to differentiate. And with influenza, it comes with, its own problems. So patients who have influenza will have low immunity. And if they have influenza and COVID, it's going to be a double whammy. So it's going to be tough. So right now we have the medical staff are having a little bit of a break right now. So, we're taking our times, and we thank God that we have a little break, and we, just getting ready mentally and physically for the next wave.
How can people prepare or be a little bit ready for, the influenza season? Like, take extra vitamin C, eat healthier. What are some of the things that they can do to kind of help prevent that?
So the first thing that I would advise my patients that are listening is that it's really important this year to take the influenza vaccine. Extremely important to do that, more so than any other years, because you want it to protect your immune system. You don't want to lower your immune system by being infected with influenza, right? So it's really important to start the vaccinations early. So normally around October of every year is when we start doing the influenza vaccinations. But this year we're going to start a little bit early. So starting September, which is next month, we're going to promote, patients coming in and getting the influenza vaccine so they can get the protections that they need. And just a reminder, the influenza vaccines takes 2 weeks for it to kick in, for your body to start making the antibodies. So September is a perfect time to get yourself vaccinated for influenza.
Okay. And what about, because some people are a little bit afraid to still go out to a doctor's office or the pharmacy. Do you know of any services that kind of like a drive-through where you can come in and, get your shot and not go into the office itself?
Right now in the Imperial Valley, I don't know of a service And like I said, next month, September, would be a good time because the number of positivity rate in the Imperial Valley is right now low. So the last time I read was yesterday. It was reported through the county health department that the positivity rate is right now sitting at 8%. And that's been the lowest ever the pandemic started. So now is a good time for you to go in and get your shots. And if you're needing pneumococcal vaccine, now is a good time. Now is a good time to get all of your vaccine up to date and get all the ducks in line. Yeah. So there's not as many sick patients that are coming in now. So I'm starting seeing a lot of well patients. And in every single doctor's office, we have a sections where we have one for sick patients and one for well patients. So at Full Medical Center, we see all respiratory patients outside. So if you're having respiratory symptoms, we would see you outside, and then we would let the well patients without any symptoms and without fevers going inside the office still with the mask, with this social distancing practice going on. And then if for patients who are immunocompromised, senior patients, if they are afraid of going in, we can accommodate. So there's that accommodation. So patients can remain in cars and we can go and we can inject. Right now, we don't have, we're not in the flu seasons where we're having the vaccines go out yet. So I haven't had anybody request, for us to go out in the car. But if there is such a request, we would accommodate.
Venus, can I add something real quick? I think something that I want to discuss and ask you is right now, students are going back to school and children are starting school, kindergartners and so forth. And so there's always a immunization requirements. What suggestions or recommendations would you have for parents in regards to, making sure that they're meeting that fulfillment? Maybe there is fear and maybe there are those, people who are just afraid to bring their children into a doctor's office. So maybe can we talk a little bit about that in regards to maybe your suggestions or recommendations for small children?
Yes, now is a good time. Now is the time for you to bring your children's in. If you've have put it in the back burners and you haven't bring your kids in to get vaccinated, now is the time, like I said, because the number of positivity rate is lowest since the beginning of the pandemic. And at Vol Medical Center, we have a separate areas for children's. So your children's have a waiting area just for children's, and children's are being screened also at the door. So if a child is having respiratory symptoms or fever, they will be seen out in the car. Our pediatricians will go out into the car and see your child's. And so there's that, there's that measures that is put in place to make sure that, all the parents are, that safety measures, so that parents are more reassured that when they go into the office that they are not going to encounter sitting and waiting around with other sick kids or sick parents. So everybody is being screened at the door. And yes. Mm-hmm. So, and again, in the medical office, we always try to keep it clean, keep it safe, keep it sanitized, the best we can, so that we can protect the patients, because we don't want to do harm to you, right? So yeah, so we put in all the safety measures to make sure that everybody who is coming into the door is safe as possible.
Okay, good. Is there anything else that you would like to inform the community about, taking precautions, not letting your guard down with, I know our numbers are low, but I feel that, a lot of people, like when they see like these numbers are going down a little bit, they start to get a little bit more relaxed and, not be as safe as they should be. So is there any advice that you can give the community about, still being safe about this whole thing?
Yes. So it's really important to continue to practice social distancing, practice all the safety measures that are put out there by the counties, all the guidelines that are put out by the counties, because we want to continue to drop the numbers lower, so that we can open up, we can send children back to school again and open businesses and have our economy back up, local economy back up. Because I know that since the beginning of the pandemic, a lot of families lost their jobs, a lot of businesses closed down due to the pandemic. So we want to help our community. We want to help our neighbors. We want to help children. We want to help, everybody get back to normalcy, right? And how do we do that? By abiding to all the safety measures. We're not asking for a lot. Again, put on your mask when you go out into the public, keep the 6 feet distance, and then keep your hand clean. That's all we ask, right? Until we get a vaccine, right? So please help us, help us, the medical community too, as we're buying time for a vaccine, right? Because the COVID is not going to go away anytime soon. The vaccine is going to help control it. And right now, the scientists are working really hard to come up with a vaccine. But until then, please help us help you by following all the safety measures. Yes. Yep. And then now is the time to focus on your health. So if you've not had your diabetes control, now is the time to, go back into the doctor's office, have your labs done, have your A1C checked, make sure that your sugar is in check, make sure that your weight is under control, make sure that your high blood pressure is under control, make sure that your cholesterol is under control, make sure that you are in your best physical form so that you can take on another round of COVID in the fall. COVID and influenza.
Yeah. That's something that I was telling Martha, is that during this pandemic, a lot of people have been a lot of my friends have been gaining weight, and I lost like 30 pounds during the pandemic because, I've been careful because I have high blood pressure. So, I've been trying to, but it's hard because I was talking to my doctor and he's like, I told him, I lost 30 pounds. He's like, oh yeah, you need like 30 more pounds. I'm like, what? Like, because according to my height and my weight, my body mass index, I'm obese. So I'm like, man, I need to be like my weight back in high school to be. but yeah, I mean, I think it's really that's something that I tell people is that, it's I know we don't have a vaccine or anything, but there's things that we as, everyday people can do to, if we do get this disease, we can, handle it a little bit better and not get as sick. And, so yeah, that's something that I try to, keep telling people is like, eat healthier, drink vitamin C, keep your, help your immune system, fight this virus if you do get it.
Yes, because you're going to have to depend on your immune systems to help fight the influenza, the cold, and the COVID-19 virus this fall. Yep. So you have to be in your best shape. So start, your daily exercise, half an hour a day, eating healthy, cutting out all the trans fat and the glutes and the carbs, right?
All the yummy stuff. Is there anything else that, you guys would like to add that we haven't talked about or touched?
You know what, Jose, I want to take this opportunity just to share with you that with Vo Medical, we went ahead and opened up, we have a nonprofit organization, which you have seen many of our meal delivery programs that are in place. And so I want to share with you, not only has Vo Medical been on the front line in providing services to clients and to patients and to the community as a whole. And what came or transpired of this is that Dr. Vo and Miss Venus were noticing in the community that patients needed assistance. We had to make sure that fear is so paralyzing, and patients were feeling hopeless, and many patients were living on their own and didn't have any other means in regards to getting groceries or being able to, even cook a meal because they weren't even physically in that condition. And so Dr. Vo and Miss Venus came together, and they brought a group of board members together, and we have really taken a look at seeking how to fill in gaps for vulnerable populations and being able to provide services. And that's the meal program that you have seen out in the community. And 60 meals a day are being cooked and provided and delivered to patients who are COVID positive. And our goal is to take care of our neighbor. I'll go ahead and leave it over to Miss Venus if there's anything that you want to add in regards to the efforts that are going on in our community as well.
Yes, so I thank you, Martha, for filling me in. And I wanted to take this opportunity to thank the Vo Neighborhood Medical Clinic Board. Martha Singh is on the board, along with Mr. Chuck Fishers, Dr. John Strong, Gayla Strong, his wife. Who else is on our board?
Stella Mendoza.
Stella?
I'm sorry, Stella Jimenez.
Yes, Stella, Dr. Clara Padron, also on our board. Matt Desert is on our board also. So I thank you for your support in these missions. And besides thanking the board, I would also like to take this opportunity to thank the volunteers. We could not carry out this program without the volunteers that came and helped us deliver these meals. Yes. So a big shout out to all of the volunteers out there.
Yes.
Being, the Vo's Meal on Wheels program and make it a success. So currently we have, I believe, we have 60 volunteers, and we have, I believe, we have, how many routes are we doing right now, Martha?
We're in three major cities right now. So we're in the north end and the south end, and there's 3 delivery sites. And so the meal is provided at 3 different locations. And then our volunteers, who are amazing, deliver to at least 5 patients. And so they pack up the meal, they put it in their trunk. There's all the safety precautions in place, and they'll text the individual that is going to be receiving the meal. They send them a text. They let them know that, to please not come outside, and they'll let them know that the meal will be provided within the next 15 minutes, because we also know it's hot. So we don't want food sitting out in the heat. And so it's a really good coordinated effort. I'll tell you, in speaking with volunteers, I think what they have shared with us, probably the most rewarding moments, is when someone waves to you from the window and whispers thank you, or you could read their lips as they're telling you thank you, right?
Yeah.
And they said that's why they do it, because you have to ask. It's been 118 degrees and delivery is at 5 o'clock, in the evening. And you're like, why would someone, put themselves out there in that heat and make that connection with someone who we know is positive and so forth. But we run deeper than that. Here in Imperial Valley, we're a familia, we're a family. And so we take care of our neighbors, and we do a coordinated effort. It could not be done without our volunteers, who are very, very gracious with their time and their efforts to make sure that we're helping our neighbors.
Yeah, definitely. Thank you to them. I like you said, like it's been super hot. They're dealing with people that are, positive with COVID. So, kudos to everybody that's been doing this for our community, and thank, Vomedico and the board and everybody there that, it's been doing this for our community. Ladies, thank you so much for taking this time. I know Venus is super busy, your husband, and I actually reached out to your husband through Facebook, and I told him if he wanted to be on. He's like, "Oh, I'm really busy," and I was like, "Yeah, I understand." But yeah, thank you so much for what you guys are doing for the community. It's amazing. I've seen the stories and heard about the stories, and it's really heartwarming.
Well, thank you. Thank you again for inviting me and Martha to join you on this podcast today. And I'd love to come back whenever you need me. Just call me, and I'll be happy to be back on again.
Great. Thank you.
Venus, I'd like to take this opportunity to thank you and Dr. Vo so much for stepping in and just being on the forefront. I really appreciate all that you have done for our community and continue to do so. I hope that you're sleeping a little more at night now that we're seeing that the curve is starting to, to come down a little, and hopefully that'll give you some time to just rest and take a little bit of a breather, which means that now you'll probably get 4 hours of sleep instead of 2. Take care of all of you. I send you a strong virtual hug.
Thank you.
Wish you a beautiful evening.
Yeah. All right, guys. Thank you so much for listening. And we'll see you in the next one. Take care. Wash your hands and wear your face masks.
Thank you.
Bye, guys.